Hello everyone, I'm Dr. Merkle. I'm here today to share with you what the Foundational SBN Panel is. Now this SBN panel I developed about 40 years ago. It has been modified a couple of times, but it is rock solid. It's a good starting point. It can give you direct indications of problems, and it can give indirect indications of problems, and I'll share what we mean by that as we go through this presentation. This lab testing is very important. In fact, it's something I recommend everybody does once a year. Conditions will show in the blood long before you have symptoms, and you want to catch problems as soon as possible. Now, for my own testing, I do far more than this. I want to check for specific cancers, heart disease, and other tests I'm going to look at. But the foundational for most of my patients, we're going to start with this. And if people want more testing, we offer it to them, and they can do that right up front. But sometimes, many times, this original testing that we're going to go over can indicate the need for other tests. So let's get right into this foundational lab test that everybody needs to start with. Okay, so we start off with glucose and the A1C. These are diabetic factors. Now, I'm not going to go into each test and explain what it means. And we have a color coding for science-based nutrition. Yellow is warning, red is clinical or danger, and blue is code blue, crisis. So I'm not going to explain these because anything that's red, yellow, or blue will be explained in detail in the report. And it will integrate it with other tests, side effects of medication, effects of medication, as well as vitamin deficiencies and any surgeries a patient may have had. So let's just go into it again. We're going to look at diabetes. We're going to look at uric acid, which can indicate diet, obviously along with diabetes. This can indicate diet, inflammation, and kidney disease. So the uric acid, BUN, creatinine, GFR, BUN, creatinine ratio can indicate kidney disease. Then we have our electrolytes, sodium, potassium, chloride. Electrolytes. Then we have our macrovitamins, calcium, phosphorus, magnesium. Then we go into our protein levels, important for immune system, for muscle building, energy, all that stuff. And then we're into the bilirubin, gallbladder, liver. And we're into alkaline phos, creatine kinase, and LDH. Inflammatory markers, tissue breakdown. These can also be indicators of cancer. And if you have certain cancers, these can be your tumor marker, your direct tumor markers. Again, I'm not going to go into which cancers can be indicated here, but if they're elevated and you don't see much significant improvement in a couple weeks, or you want to check it out anyway, do a cancer marker. Or sometimes you need to do the isoenzymes, LDH isoenzymes, CK isoenzymes, and they'll give you an indication of disease or tissue damage that's occurring. Okay, so we've got that. Then we go to SGOT, SGPT, and GGT, liver and pancreas function. Then we go to lipids, cholesterol. We know all about cholesterol and lipids, so we're not going to go in detail on that. Then we're into thyroid, TSH, T3 free. We got our thyroid covered here. Now we're at CRP and ferritin. These are inflammatory markers. Again, tissue breakdown, inflammation. We've got ferritin, C-reactive protein, LDH, alkaline phosphatase, CK, all inflammatory markers. And then we go into serum iron. We have levels of anemia here. The white count, your immune system, maybe infection or other metabolic disease states. But we've got our anemias, and then these other values can indicate types of infection. Then moving on down, we've got your SED rate right here, your SED rate, which is also an inflammatory marker. So we have several inflammatory markers which can be helpful for autoimmune disease, including Crohn's, ulcerative colitis, psoriasis. Virtually any autoimmune disease are going to be, some of these are going to be elevated for that. Cancers will have these things elevated too. So this is a good overall view. And then the last one on our panel is vitamin D. And we all know how important vitamin D is. And so vitamin D by itself, if tested by a medical doctor, is generally going to run $200 to $300. But for this entire panel that I just went over, and the panel, the SBN Foundational Panel, is all of these tests down to vitamin D. This is the end of it, vitamin D. And right now, this is 2026, I think you can get these tests for less than $500. You can't even get vitamin D for less than $200. That $500 includes vitamin D. Great bargain. We've had doctors that work with us. Their patients went and had their medical doctor order these tests, and there's been times they've been charged $2,000 to $3,000. Even one patient, their doctor charged the insurance company $8,000 for this blood test. True story. $8,000. Because the patient thought, I only have to pay 20%. My medical doctor orders it. What's 20% of $8,000? Yeah, $1,600. $500 would have paid for everything if they had just paid it at time of service. So it's much cheaper to get it through your science-based nutrition provider, and it'll save you money, and you're going to find out tremendous information, because everything that's red, yellow, or blue is going to be explained in the report. Now, as you can see, there's other tests in here you can do. And I get a foundational test every year. But I also do other testing. A cancer panel I developed, coronary panel, heart panel, hormone panel. And I just recently, last year, added a neurological, longevity, chemical toxin panel. So I do those once a year because conditions show in the blood long before you have symptoms. Long before you have symptoms. And the earlier you find a problem, always the better results you will have, less damage has been done. So I always recommend you check the score. You don't wait till the basketball game or the football game is just about over, seconds left before you check the score, do you? No, you're monitoring that through the whole game, and that's what you should be doing with your body, is checking the score. There's never a time too early to start checking the score. And then because of all you have to do is make a couple little tweaks here and there, far better than doing an overhaul because you let things get out of control. The earlier you find a problem, better results you'll have. And even serious problems sometimes have simple, safe solutions. So that's why we test, and I recommend everybody start with your foundational panel. Get your baseline. And we'd love to help you with your health problems. If you'd like to get tested, be sure and contact us. And we'll find a way to get you tested no matter where you are. There's ways that you can get tested. But make sure you start at least with this foundational blood test. Have a great day, everyone. I'm Dr. Merkle.